a speech and language therapist who has been working for over 14 years with children with special needs, a Haanen certified speech and language therapist for the More Than Words and It Takes Two to Talk programs, and trained in PECS, prompt technique, brain gym, and oral placement therapy. Currently the only therapist in India who has completed Level 3 certification training in oral placement therapy, now serving as the clinical director and trustee of PlayStreet Specially Abled Educare Trust. It is an honor to welcome Shereen Idiculla, who will speak on oral placement therapy and prompt.
Good afternoon, everyone. I know there was some excitement earlier and everyone woke up after lunch. Now I'm the fourth person to talk, so we might not be so excited anymore. I'll try not to bore all of you. Some of you might have been with me last year when I did the presentation at Aster Med City. It's very similar, so do bear with me. Maybe you will learn something new this time. So I was asked to talk about two approaches that we use in speech therapy, oral placement therapy and prompt. Now, when I did prompt first, actually. I learned it about 11 years ago. And although I learned it and I saw a lot of benefits with the technique, I wasn't able to move forward with my nonverbal children. I was getting quite stuck. So about in 2010, about 8 years ago, is when I got into oral placement therapy and started learning more about it. And that's when I found this missing link to be able to help more children. So my focus today is kind of comparing the two approaches, seeing the differences, seeing the rationale behind it, who it can be used with, so that we understand before we leave how it could benefit children with autism who might also be diagnosed with apraxia of speech or who might have dysarthria. Okay? So just looking at what oral placement therapy is, traditional therapy looks at, look at me, say what I say, right? Imitation. What oral placement therapy does, it adds another component there, which is the tactile component. So it works on auditory stimulation, it works on visual stimulation, but it also adds another component, which is the tactile stimulation, to improve both feeding skills as well as speech clarity. Now, in this presentation, I'm not going to talk too much about the feeding skills, but focusing more on speech production and clarity. It was developed by Sarah Rosenfeld-Johnson in the late 1980s. And it is a tactile proprioceptive teaching technique, and it is an important addition to the traditional therapy. It is not done on its own. It is another component that can be added in. PROMPT, on the other hand, is an acronym for Prompts for Restructuring Oral Muscular Phonetic Targets. It's a mouthful, I know, but it is also another tactile kinesthetic approach that uses touch cues to the articulators to help a child move from sounds to syllable to word to phrase and to sentences. And I will show you videos at the end of this presentation to help you understand how it is used. And this was developed by Deborah Hayden in the late 1970s. Now, one more term that I would like to introduce to all of you is oral placement disorder. Now, as defined by two famous people in this field, Diane Barr and Sarah Rosenfeld-Johnson, children with oral placement disorder, they find it difficult, like I said, to follow the instruction, look at me, say what I say, or when you say close your lips and say, When either of these instructions are given, they get lost. They are not able to move forward. So those children would be categorized under oral placement disorder, and this is where these two approaches are quite beneficial. Now, the rationale behind these two approaches is the feedback that we get from different systems. Touch, movement, pressure, the feel of all of this is very important to help us move. Now, let me give you a simple example. When your leg is numb, will you be able to walk? It's just a yes or no question. No. Why? What do you think would happen if you walked when your leg was completely numb? You'd fall. right? We all go like, come on, let's get some feeling back in there, and then we start walking, right? So there is a lot of feedback that we need to be able to create a movement. If I do not get the feedback, I will not move. So this concept that touch, the movement, the pressure, everything is very important to create a movement. That is the rationale behind these two approaches. Now, let's look at why these approaches are useful. Let's look at speech first. What is speech? Right? We look at speech as generally like, oh, talking, that is speech, that's about it. But there are a lot of critical components that make up speech. One is awareness. Awareness, which is the sensory component of a motor movement, is whether I can feel my articulators, whether I can feel my jaw, whether I can feel my lips, whether I can feel my tongue. If I do not feel it, it's like your leg going numb. I will not move it. Or if I feel too much of it, if it's so sensitive to the feel and you have a negative feedback, you will still not move it, which directly impedes speech clarity. All right? The other one is, once you feel your articulators, then you have to place them in the exact place to be able to produce a specific speech sound. You need to have a lot of fine control movements with your mouth to be able to produce different speech sounds. Now, if I needed to say ah, and I need to say e, I would need to move my jaw in a specific way to be able to get to ah, and a specific way to get to e. Otherwise, if I don't have that fine control movement, this is what's going to happen. I'm just going to say And what does that affect? Your clarity. All right? So it is very important to have this fine control movement. Now, once you have a movement, it is important that it becomes automatic. We don't think about walking now, we just walk. We don't think, oh, I have to put my right leg first, oh, I have to put my left leg first. We just walk because it has become such an automatic movement for us, it has become a memory. The same way, for us to produce sounds or to sequence sounds and to pair it up, we need to be able to create those kind of patterns in the brain. That happens only with multiple repetitions. So when we keep repeating the movements that we are doing, it becomes automatic, and once it becomes automatic, the production of speech becomes much easier. Just making a child say 10,000 times is not going to help. But how do you make it also meaningful for the child so that they are motivated to say it? And that's one of the things that are most difficult, especially for children on the spectrum, motivation to be wanting to say that particular sound, right? So there are different ways that we kind of build that, but the stability and endurance, the muscle endurance is also very important. Now, if our muscles are weak, we will not be able to, for example, if you want to lift a 100-kilo weight, will you just go and lift it up? No, you'll probably injure your back, or you wouldn't even be able to lift it. But what you will do, if that's your goal, we will start with maybe 5 kilos, 10 kilos, build it up, build it up, build it up, till we can reach that 100 kilos, lift it up without injuring ourselves, and having the stability in our body, and having that muscle endurance, right? So that is the important thing even for speech. We tend to forget that those gross motor movements that we create are also creating these fine motor movements in our mouth. So we need that stability in our mouth, we need the muscle endurance, and we need muscle memory to be able to produce different speech sounds. And finally, there's production. So these are the 4 components of speech that are really important. There are also a couple of systems that are important, that is respiration, phonation, resonation, articulation. These are all the systems that need to work together to be able to produce sounds. Now, if, for example, I'll just give you one example in that, is if a child is not able to, for example, blow a horn, blow a whistle, I'm going to connect it for you for speech, and the child is just, he's just doing this. He's blowing it, but it's just so quick. If he does that and he takes it to speech, like this. I cannot talk like that. What do we do when we talk? We take a deep breath, We release the air so slowly with the abdomens so that we are able to talk so much in one breath. Otherwise, I'd have to take a breath for every word I say. So all these movements are very important to support speech. And that's the thing that we need to really look at when we are looking at kids who are not able to produce speech. Why are they still nonverbal? Why are they not imitating? What is missing there? So these are some of the components we need to look at to make sure that the delay is bridged. Now, there are different systems that you can see, they're all connected. There's nothing where the arrow doesn't connect to the other. You have the sensory system that's connected to the motor movement. Like I said, if I don't feel, I won't move, right? You have the motor movements that are necessary to produce sounds. And for the clarity of sounds, instead of going, I have to say I. Similarly, if I don't like the feel of food in my mouth, or I have a negative feedback towards food, I will not develop those skills that are necessary to eat appropriately. Now, if I'm eating with a spoon, I might just use my teeth to clear the spoon rather than using my lips. Now, if I don't use my lips, it can cause physical changes where the lips start moving up. And if they start moving up, I will not be able to close them. If I'm not able to close them, I cannot produce a sound like p, b, or m. So there is a connection between all these systems which finally affect our feeding and our speech production. These are the two things that we do with our mouth. We eat and we talk. So what we need to do is work on both these skills so that we're able to move forward with respect to speech production also. Right, so what do we look at in these two approaches is whether, first, if there's, in the traditional approaches, if there is no problem, we will just go with the traditional approach. OPT and prompt need not be always used, all right? So we kind of identify whether there are certain issues, and if there are no issues, as per what I will mention a little now, is that we go with the traditional approaches of articulation therapy, phonological approach, whatever it might be. But if there are issues, we look at, is it a sensory deficit? Is it a feeding deficit? Or is it an oromotor deficit? And if it is any of them, that is when we start dealing with those particular issues. So we might need to develop sensory strategies to help the child feel more, maybe feel less, whatever the child is showing us, because if he feels a lot and he's sensitive, you need to desensitize the child. If the child is not feeling enough and is stuffing his mouth or mouthing objects continuously, we need to be able to give them input appropriately so that they stop doing those things and hence better motor movements can develop. Okay? Similarly, if there are feeding deficits, we would implement feeding activities because feeding is a prerequisite for standard speech production. The movements that you create for feeding are the same movements that you will use for speech sounds. Okay, so there is a strong correlation between these two. So for some children, we don't start with speech directly, we start with feeding because that's the most natural thing for them. We create movements and then put speech in there. Okay, I'm just going to move ahead. So same, if there are oromotor deficits, for example, if a child is with his mouth open the whole time, are you going to work on MP and B? You can't because the child does not have closure. So there is an oromotor deficit there, in which case we would start creating that movement first before even working on those speech sounds, right? Now, what does it exactly help with? So, like I mentioned, awareness. OPT helps with awareness of the oral mechanism. It helps normalize the oral tactile sensitivity, whether the child is hypersensitive, whether the child is hyposensitive, whether it's fluctuating, whether it's mixed between the two, or whether the child is defensive. It helps to normalize it, because only if we have a system that's normalized, we are able to create appropriate motor movements, and that's what we work on number 3, normal movement patterns for speech sounds. It also creates, like I said, fine control movement. Very fine control movement is important so that I can speak clearly. If I don't have that control movement, I'm not going to be able to speak clearly. This is what's going to happen. So my language might increase to about 3 to 4 word sentences, but if my motor system is not going to support it, I will not be able to talk clearly. It also helps with appropriate feeding, nutritional intake, like I mentioned, planning movements, and sequencing speech sounds. Now, it's not enough that a child just makes a sound, ah, per, b. That's not enough. That's not words. That is not expressive speech. So the child needs to know how to go from a per to a ah to a per to an ah to say papa, right? So for some children, especially with children with apraxia of speech, they're not able to sequence those sounds. They're not able to understand how to move from one sound to the next. And that's where this helps, because it adds a tactile component to help them register what they need to do. And touch is a very strong sensory system. It is a system that gets activated the fastest, and that's the input that the child gets, and hence you see a lot of change. But there are some differences between the two approaches too. What OPT mainly does is it uses non-speech movements to build speech sounds, but that does not mean, this is the general misunderstanding that happens, that OPT works on non-speech oral movements. No. It uses it, yes, but it translates it to speech immediately. So if I have a child being able to, for example, blow a whistle, close his lips around a whistle and blow it, I know I have a chance to now work on p or a b. But if the child is going like this and got no lip closure or is biting the whistle, I know he's not ready for a per b. So we use non-speech movements, but we immediately translate it to a speech sound when the child is ready. And prompt does not work on non-speech movements at all. It directly works on speech. The other thing is OPT works actively on targeting muscular weakness, whereas prompt doesn't. OPT also directly works with the sensory system, and prompt does not. And also feeding skills. So these are some of the differences between the two approaches. And it can be used for any child or any adult or any individual where the muscle function is affected, where there's a weakness in the muscle, where strength, stability, endurance, dissociation, grading, any of these fine control movements are affected, where there is a motor planning issue, the child is not able to plan the movement, not able to sequence sounds. These are some of the issues, these are some of the problem areas where OPT and prompt could help. Now, if you've seen, I have written which helps with what. For example, muscle function or dysarthria, OPT would help, not prompt per se. So there are different areas where OPT would help more and where prompt would help more. So management-wise, if we said sensory, feeding, oral motor difficulties. If there are sensory difficulties, like I mentioned before, we try to create awareness and normalize the oral tactile sensitivity by doing different kinds of sensory massages, outside, inside, and by wearing different inputs. Now, when you do massages, another thing to remember, random massages will not help. If you are doing sensory massages, it needs to be where you are waking up the muscles that are needed for speech. So just randomly moving the muscle is not going to help. Speech is a very symmetrical movement. Speech is a very forward movement. So that is exactly what you're going to do and incorporate into your sensory massages. All right? This is just some of the exercises that we do as part of the sensory massages, just to give you an example of what it looks like. So these are some of the tools that can be used. This can be used outside on the oral cavity. Simple things that you could buy in the market. These are things that you can, this is mainly for inside the oral cavity that you can use. There are different tools that are available. It's just that you need to know how to use it. Don't just pick one up and use it in random, because that is not going to help and might cause more harm to the child than any good. All right? So please know how to use it before you use it. Now, if there are oromotor difficulties, there are definitely things that we do to work on the articulators, to strengthen them, to work on fine control movements. Between the articulators that you're aware of, which do you think is the most important for speech? You are not allowed to answer. I know you've attended the course. But yes, generally, till I did the presentation last year, everyone would tell me tongue. Tongue is the most important for speech. Now, what I'm going to show you is what happens if I lock my jaw and what happens if I lock my tongue. And you can see the difference in the clarity of speech. Now, I'm going to lock my jaw, keep it in open position. I can either close it or open it, but I'm going to show it in open position. I can move my tongue and I can move my lips, but I cannot move my jaw. Okay? Ho, he, ho, ha. I just counted 1 to 5. All right? And now I'm going to lock my tongue, which many of you think is the most important articulator, and I'm going to count the same way. 1, 2, 3, 4, 5. Which one was clearer? So which tells you that the jaw is the most important articulator. It is not the tongue. The jaw is the base for everything. If the jaw is not strong, the jaw is not stable, it will not support the lips, it will not support the tongue. And because of that, you get poor clarity of speech. All right? So these are some of the tools as part of the OPT program that we use to develop oromotor, to address the oromotor deficits and to create some strength. 1, 2, 3, 4, 5, 6, 7. Blow harder. Okay. 1, 2, 3. So as you can see, there are different movements that are created using these tools. Now, if you saw the chewy tubes during the video, the chewy tubes are, you can see that T-shaped red and yellow one. When you ask the child to bite and release, what you are doing is getting the jaw to move up and down in a very controlled manner, which is important for all your vowels. A, I, E, O, U, all of these are controlled by the jaw. Now, if your jaw is weak, your vowels are automatically going to get affected, and if your vowels are affected, 90% of your clarity is gone. Right? Another example was the whistle. Like I said, you can see that the child here is able to move his lips forward, is able to blow the whistle, and hence, okay, he's got that movement. I can work on per and bur without a problem. But if he was not able to blow, I wouldn't target that sound at all. And feeding is another important component because, one, the child might be very sensitive to food and does not like the feel of food in his mouth, and each mealtime is a struggle for the parents or it's being forced down his mouth. If it's such a negative experience, we need to target that very actively so that the child is able to accept food, right? And there are also some movements that we create using different techniques like cup drinking, straw drinking, spoon, using a spoon. Now, I give you an example of when you drink from a straw, what do? What is the movement you do with your mouth when you drink from a straw? If you can try it out. What is that? What do you do? Okay, so when you suck, what is the motor movement you do with your articulators, your jaw, lips, and tongue? What happens to your jaw when you suck from a straw? Is it open or is it kind of closed? Kind of closed, a little bit, right? It's not completely closed, because then you can't suck. What happens to your lips? Sorry, I didn't hear anything. It's rounded. Yes, it's rounded. Okay, and what happens to your tongue? Do you know what happens to your tongue? It goes back, all the way to the back, and that's the position the tongue needs to be in for a lot of the speech sounds except the. All right? Now, if you get rounding, what are the sounds you can work on? If you can say it louder. Oo, O, W. These are 3 sounds I can work on because I've got lip rounding now. Right? So one is connected to the other. We use one to target speech sounds. All right? Oh, wait. Oh, no. Can you move it back? I'm sorry. I just want to give a... Hold on. I just wanted to give an intro before I showed this video. So this is a 10-year-old boy with autism and apraxia of speech. And here we have built the movements, and now we are trying to transition it to speech. Now he's able to produce the sounds in isolation, as you will see, but he found it very difficult to sequence those sounds out. The mum here is working with him on sequencing sounds to create proper words. All right, if now you can play it.
Very good. Very good. Next. Next. A. E. A. E. E. Very good. Very good. D.
This is a prompt technique she is using.
Very good. Very good.
Along with OPT.
Water. 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 Very good. Water. Very good.
I always tell him when I go back, you're always a hero of my presentations because, you know, everyone claps for you. All right, and this is prompt.
My turn. Good boy, again for me. My turn. Good job. One. Now two. Two. And now go. Go. Yay. Okay, let's put this on.
So here you can see that the child works directly, the therapist works with them directly on speech. This was difficult for me when I first learned it because with my nonverbal children, they were not making a sound. If they were not making a sound, I couldn't shape anything. If they were making some vocalization, then I could shape it. So that's where OPT helped me first to get some sounds happening, some babbling happening, and then we were able to use prompt to shape those sounds into words and phrases. So it is important to note, because a lot of parents come to me and tell me, I want OPT because I want speech. OPT is not going to suddenly produce speech. OPT is a small component of a therapy program. It does help build the foundations, but it's not the end-all. It does not work on just non-speech movements. It is transition to speech, and you use prompt technique to actually help transition to speech. And in conclusion, tactile feedback, kinesthetic feedback, proprioceptive feedback, motor planning, all of these are very important for speech production and clarity. So for a child with autism who might have a diagnosis of apraxia of speech or even dysarthria or even both, these approaches would be quite useful. Thank you.
Thank you, Shereen. Lakshmi, in charge of communications and art, at CADRRE will be presenting you your memento.
Thank you. Okay.